I know families are concerned about the recent outbreaks of Strep A in children. And while the vast majority of Strep A cases are mild and can easily be treated with antibiotics, a small number have gone on to develop serious infections. The UK Health Security Agency has already declared a national enhanced incident to coordinate our public response, and the increase in demand has led to some temporary supply issues. But I want to reassure members across this House that we do have stock of antibiotics, and we have taken a number of steps to deal with some of the supply issues. The key issue is in getting this stock to pharmacies across the country, and we have brought forward stock to make sure it gets to where it's needed, and we are expediting deliveries. Secondly, we have issued 8 SSPs to allow pharmacists to supply not just alternative forms of penicillin, but alternative antibiotics. I know, Mr. Speaker, this is a worrying time for families across the country, but we want to reassure families and those across the healthcare sector that we are managing the higher than normal number of Strep A cases this winter, and we have a range of medicines available to manage this.
Daisy Cooper.
Thank you, Mr. Speaker. Across the country, parents are worried sick about the sharp rise in Strep A infections, and tragically since September, Strep A has caused the deaths of at least 19 children. Last Thursday, after just a few days after insisting there were no shortages, the government finally admitted that there were indeed serious shortages of 3 penicillin medicines, and they issued severe shortage protocols to give pharmacists emergency powers to deal with supply issues. Mr. Speaker, why on earth has it taken so long? Because the government didn't come clean about the shortage of antibiotics sooner, patients have been left to travel to multiple pharmacies worried about their children, GPs have had to find time to rewrite prescriptions, and A&E departments have been overwhelmed by anxious parents and children who can't access the medical help when they need it. And after the shortage of lateral flow tests, HRT, you name it, why are we in this position again? The government seems incapable of doing forward planning, and we are stuck in a shortage Groundhog Day.
And there are pressure on supplies. We have the stock of antibiotics in the country. As I outlined in my opening remarks, it is the supply issues. We are seeing 5 to 6 times the amount of antibiotics being prescribed at the moment. But that is because UCSA have issued guidance to GPs, to A&Es, to healthcare professionals to lower the threshold of when they would normally give antibiotics. So we are seeing a significant number of increased use of antibiotics.
We first heard about shortages of antibiotics to treat Strep A almost 2 weeks ago. But when my right honourable friend, the Leader of the Opposition, raised the issue with the Prime Minister, he said, and I quote, "There are no current shortages of drugs available." But at the same time, parents were going from pharmacy to pharmacy to find the antibiotics their children had been prescribed, and they simply weren't available. Why did the Prime Minister not know there was a problem when it was plain to see for parents of young children across the country? Had the government been aware of the problem sooner, surely they could have acted to secure supplies earlier. The Minister in her reply said there's been no shortage but a supply chain issue. But if you're a parent turning up to a pharmacy and they haven't got it, it doesn't make much difference then whether it's called a shortage or a supply chain issue. The antibiotics aren't there. The government must get a grip on this situation and be honest with the public about the reality on the ground.
I think the Minister has a different definition of what a shortage is to the parents. One parent in my constituency got in touch with me last week, a local mum of a 13-month-old little boy who has been diagnosed with Strep A after a frantic search for antibiotics, during which the doctors changed the prescription in desperation to try and find that prescription. She managed to get a third of the necessary prescription. Since then, she has been trying pharmacies repeatedly to get the remainder. Today, she runs out and she still doesn't have the drugs she needs. What is the Minister's message for that mum trying to keep that little boy safe?
Well, I thank the Honourable Lady, and what I would say to her is we recognise that there are supply issues with pharmacies. That is why pharmacies now have the flexibility, and since before last week had that flexibility to adjust doses and to adjust the preparations. Since Friday, they've been able to issue alternative antibiotics, and so I would say to her constituent to go back to her pharmacist who will be able to give her an alternative supply.